I really can't think of any other two plants, again, being aloe vera and rice, that Mother Nature provides for us that has such incredible health promoting benefits to them. And again, this is not my opinion. This is based on the published scientific literature. Time and time again, you see all these different studies that document different mechanisms of action of these two polysaccharides. And so all of this data that have been published are very compelling. And again, I would put them up against pretty much anything else known to humanity as being our most beneficial tools in our toolbox, if you will, of something that we can take every single day to promote our health. And oh, by the way, you don't have to wait till you get sick. I mean, prevention is just as important, if not more important, than treatment or therapy. Why in the world would you want to wait till you end up with a diagnosis of cancer or diabetes or heart disease or neurodegeneration? Let's try to prevent those things from happening in the first place. And in my opinion, I believe you can do that with these two polysaccharides and take them every day.
Welcome to Linda's Corner, where we bring more hope, healing, and happiness to the world. My name is Linda Bjork, and today we're going to be talking about nutrition. I'm delighted to welcome Dr. John E. Lewis. Dr. Lewis is a leader in clinical research, a former associate professor in the Department of Psychiatry and Behavioral Sciences at the University of Miami Miller School of Medicine, and is currently the founder and president of Dr. Lewis Nutrition. You can reach Dr. Lewis at his websites, drlewisnutrition.com and dailybrain.com, and I'll include those links in the show notes. Welcome, Dr. Lewis. I'm so glad that you could join with me today.
Thank you, Linda, for having me. It's my pleasure to be here. I look forward to our conversation.
Thank you. And I'm so excited. I enjoyed very much watching your TED Talk, and I would love to talk about some of those things that you brought up. One is you talked about the epidemic of chronic illness and obesity in the United States, and you mentioned that our country spends $2 trillion on our healthcare system, and that's trillion with a T, which is a lot of dollars. But we're not getting good results. In fact, you don't even like the term healthcare system because it's not really caring for our health. It's just treating diseases with pharmaceuticals. And you also said that what healthcare really is taking care of our health every day. So is it okay if we kind of talk about how it's nutrition actually that is caring for our health and why it matters that we understand that?
Linda, it's so important. And in fact, that shows how dated that talk is that I gave, because now that figure is all the way up to over $4.5 trillion with a T. So it's more than doubled since I actually gave that TED Talk, which is just staggering because that happened in a very short period of time. But as Hippocrates said, let food be thy medicine, which was well over 2.5 millennia ago. So this is before our calendar even started. To have that ability to have that foresight, to have that, whatever it was that he was blessed with, that intelligence to look at someone's body, look at and evaluate whatever that person was feeling in front of him, and then to be able to determine what he determined at that time, to me is very profound. And so really, when you look at the science, when you look at the literature, and the best source to do that, generally speaking, is to go to PubMed. Just go to pubmed.gov and you can do your own literature search. Anyone can. You don't have to be a scientist. And if you just start exploring all the information that's been published over the last few decades relating different behaviors to chronic diseases, it's an overwhelming this is a bit opinionated, but it is an overwhelming amount of evidence that's been published related to nutrition compared to any other behavior, and that includes exercise. So I used to, many years ago, think exercise was our first tool in our line of defense against chronic disease. Now I've flipped from exercise to nutrition. It's just so incredibly important to be able to maintain a proper diet. And of course, that's very argumentative, depending on what your perspective on a proper diet is. But again, when it comes to the one thing that we can do either for or against our health every day, it's absolutely what we put into our mouths.
And isn't it interesting that the answer is simple enough that it's really been known for thousands of years? And here we are where we think we have the latest and greatest tech, and yet we're ignoring the most basic principles. And when you talk about research, you are a renowned researcher. Would you mind sharing some of the things that you have learned from your research studies about why this, I mean, why does it make a difference?
Well, you mentioned the TED Talk that I gave a few years ago. So that was based on, and we've published quite a few bit more, published quite a bit more information from that Alzheimer's study since that time. But in that first paper, we showed that these polysaccharides, these complex sugars from aloe vera primarily and rice bran, have just incredible health promoting benefits to them. And of course, the word polysaccharide, maybe some people don't know what that means. Poly, if you look at the two roots of that word, poly, many, saccharide, sugar, so many sugars. So unfortunately, as Americans, we've been led to believe for probably the last 50 years that any sugar is bad for us. But actually, that's a very ignorant, non-factual statement simply because sugars are dependent on two very important characteristics. One, their source, and then two, their biochemical structure. So a simple sugar, a monosaccharide, mono, one saccharide, one sugar molecule, like high fructose corn syrup is probably the best example just because it's so ubiquitous in the food supply today. It's used as a sweetener in just about anything that you'd buy in a package or a can. But that's a simple sugar. It spikes your insulin, it spikes your glucose. Then you have things like disaccharides, Di, two saccharide sugar, two sugar molecules like sucrose, white table sugar. Again, it has pretty consistent effects like high fructose corn syrup that probably both of those are not the sugars you want to eat every day. But these polysaccharides, poly many saccharide sugar are very complex sugars, again, coming from things like aloe vera and rice bran that we've studied all these years. And they just, Linda, they have so many incredible benefits. I mean, we showed in our study using this dietary supplement with these polysaccharides in them, clinically and statistically significant improvements in cognitive function. According to the ADAS-Cog, which is the gold standard for assessing cognitive function, especially in people with dementia, at 9 and 12 months in people who had moderate to severe Alzheimer's disease. That is unheard of compared to certainly the 5 FDA-approved drugs for dementia, any type of diet, any other dietary supplement, exercise, hyperbaric oxygen, red light therapy, sound therapy, music therapy, on and on and on, any other type of therapy or treatment you could think of. But that change in that effect in that study that we showed for me was the highlight of my scientific career. I'm no longer in academics full time anymore, but supporting that clinical change, we showed other very incredible effects. We showed an improvement in the CD4 to CD8 ratio. Our CD4 cells are our helper cells. Our CD8 cells are our cytotoxic cells. It's very important for all of us, not just for people with Alzheimer's, to keep that balance or that ratio optimal as we go through life. We showed reductions in inflammation according to TNF alpha and VEGF. These are two proteins commonly looked at in heart disease and cancer. Our paper was probably the first to show a reduction in people with Alzheimer's disease. And I want to make sure that people are also clear about inflammation. We actually need acute inflammation if we have an infection, if we're involved in an accident where we have a lot of trauma. So we need inflammation in those circumstances. So don't lump inflammation all in the same category like sugar as it all being bad. We actually need inflammation not only to survive, but to heal from these acute traumatic issues. And then finally, we showed an increase in adult stem cell production according to CD14 cells, which we know through other research, CD14s can become neurons. So when you put all of this picture together at the cellular level, you have very profound effects of these particular polysaccharides that, again, anytime you hear some so-called expert out there talking about all sugar being bad for you, that's absolutely an ignorant statement, and it's not even factual. So please, for somebody like me as a scientist, as an author, who is very careful about the language, I just want people to recognize that not all sugars are created equal. And in fact, some of them are actually very beneficial for us.
I appreciate all of that clarification and all of those exciting things that you shared. And when you're talking about the Alzheimer research, one of the parts of your TED Talk that I really appreciated was the man who came to you and said, "Thank you. Thank you for bringing my wife back. She recognized me. She knew my name." And a result like that is so gratifying because it is personal, it is relevant, and that makes all the difference because we're not just talking about statistics, we're talking about people. Every single one is an individual who is dealing with their own situation. So when we're talking about these wonderful things that make changes, we're talking about changes in individuals. I love the clarification that you brought about when we're talking about sugar. We can't just use a blanket statement of sugar. We need to pay attention. Is it mono? Is it di? Is it a polysaccharide? Because I think sometimes our problem is not being informed, and often our problem is being misinformed. And sometimes that's even harder because we have to remove and let go of the misinformation before we can accept something that is true. So I do appreciate that. And also, you talked about inflammation, and I would love to talk about that a little bit more. It causes so many problems. And again, the clarification, inflammation isn't bad. It's chronic inflammation that is the issue. And I think that matters too, because sometimes we think there are parts of our body or our responses that are bad, and it's not. Every response within our body is intended to benefit us. It just needs to be in the proper place, in the proper sequence, in the proper circumstances. So I think that was very helpful as well. So chronic inflammation in the body, what kinds of things can that do to hurt me?
Well, first of all, thank you for the kind words about what you said about the one subject whose wife was in the study. I completely agree with you. It's one thing to be an ethical scientist and to do good work, but when you can actually impact someone's quality of life, and in this case, in Alzheimer's, it's not just the patient, it's also the caregiver who, by the way, the caregiver of people with Alzheimer's have actually the worst health outcomes of any other type of caregiver, of any other type of patient. So these people are also very severely affected in terms of their health. So I appreciate that. And it always was very moving for me to get that kind of feedback as we were conducting the study. And then even today, even though not in the research setting, but still getting that kind of feedback every day from people who are taking our formula and experiencing the benefit of it is very rewarding for me. But as far as chronic inflammation goes, no question about it. You cannot look in any branch of either medical or public health or health science without acknowledging to some degree the role of inflammation. And of course, again, it's a bit of a tricky or murky sort of area between, where do we separate this dichotomy, right? I mean, we as humans, we love to dichotomize things. We love to label things. So where exactly does it go from good to bad? So in the case of, let's say you have an auto accident and you're severely injured. So you want all of those inflammatory signals firing properly to signal to the immune system to then create all of these other bioactive compounds and all these other cell types to then travel to that area to help the body repair, restore, and heal itself, and essentially to try to return to homeostasis. Once that acute situation is over, then you want the anti-inflammatory signaling to take over, right? Then you want all of that pro-inflammation to be shut down and then translate into the anti-inflammation. But again, that's a bit of a murky area because probably that person injured in an auto accident wasn't just acutely injured. He or she was probably, I mean, if you're talking about the typical American today, you're talking about 70 to 80% of us are either overweight or obese. We have all sorts of comorbid issues going along with that level of being overweight or obese. So probably that person injured in that auto accident didn't just deal with that acute issue. He or she was already dealing with a chronic issue. So again, it's very murky there, like, what all the body is trying to manage at the same time. And I totally agree with you that just labeling everything bad or a bad response is also really not accurate. Like, we've labeled LDL cholesterol bad, but we actually know that LDL cholesterol is trying to cover up damage to the endothelium that once again is due to the fact that we're not eating well. We're not probably supplementing with things like polysaccharides, and we're not exercising. We may be smoking and drinking alcohol and not managing our stress and not sleeping well and doing all these other things that ultimately damage the endothelium. But we're labeling LDL cholesterol as bad because it's elevated, because the body is trying to defend itself. But again, if you look at any branch of the scientific literature that has something to do with medicine or health, every discipline, every branch of that is going to have a component discussing the correlation between all of this dysregulated chronic ongoing inflammation and then risks of the typical stuff that are the ones that are killing us: type 2 diabetes, different forms of cancer, different forms of heart disease, and neurodegeneration primarily. So all of those things, if we can help the body get it back to homeostasis, which we, again, primarily do through nutrition, and especially with these polysaccharides that my colleagues and I have been studying for so many years now, we can help the body recognize that inflammation is out of control, tune it back down or turn it back down, and then have the different subsets of the immune system function properly. And I also want to make a point to our listeners too, that anytime I mention the immune system, most people, I think, tend to think of the immune system as only our line of defense against virus, bacteria, fungus, any type of invasion. The immune system, folks, is much more sophisticated than that. It does so many more things for us. And I like to use the analogy of the symphony orchestra. So in front of the symphony, you have the conductor up there, waving. He or she is waving the wand there to keep the different sections of all the different instruments in balance, in harmony, playing the music properly. So think of the immune system as the conductor of the symphony, and then all of the different music components out there are your different organ systems. And the immune system is talking back and forth to all of your different organ systems, keeping them balanced, in harmony, regulated, and functioning properly. That is such an important and overlooked role of the immune system. And I want everyone to be aware of the fact that you need to keep your immune system functioning properly, not only to defend yourself against infection, but to help keep all of your other organ systems properly functioning. So if your immune system is not functioning properly, you cannot possibly expect your cardiovascular system, your central nervous system, all your other major organ systems to be functioning properly too. So that's why fundamentally, even though and of course our brain, obviously without our brain, we are not us. But fundamentally, at this very foundational level, our immune system is so vital and so important to our entire functioning from head to toe. And it has to be fed just like everything else with proper nutrition.
What beautiful and important clarification about what our immune system is and what it does. It's not just to defend against foreign invasion. It is also responsible for our healing for each individual organ. That was a beautiful, very appropriate visual analogy to help simplify so that we can understand this is the conductor, and it helps,
Right.
And it wants everything to work together in harmony. What our body wants is that homeostasis. Our body wants to be healthy. I think that's also important to understand, because I think many people think that it's hard to be healthy. It's hard to get your body to behave itself, that it just wants to fall apart. It just is so hard. And that's not the way it's supposed to be. It wants to be healthy. It wants homeostasis. What we need to do is to support it so that it can.
That's right.
So that each individual aspect that's trying to solve a problem it gets put back into balance. It's like, thank you. You've been trying to help me, but what you're doing actually is not helping me. It's causing a problem over here. So let's see if we can get things put back together. And you mentioned that taking the aloe vera and the rice bran, that has been very helpful in getting things back into that homeostasis. So why do those things work so well?
I think there's something very special about these two polysaccharides, and I want people to also know that it's not just these two plants that can give us polysaccharides. There are lots of things, be it different types of mushrooms, seaweeds, different vegetables, different grains, different roots. There are a lot of other plants in the plant kingdom that contain these polysaccharides that are similar yet different. I don't profess to be an expert in all these other plants. I mean, they're just too many. But where my colleagues and I have focused all these years are the ones from aloe vera and rice bran. So just recognize that there is something very special. Again, I don't know why that is per se. I mean, it's kind of one of those unknowns of, why a vitamin or why a mineral or why any other amino acid or fatty acid or whatever works the way it does. It's just something, sort of this process of either the combination of creation, evolution, or one or the other, whatever the case may be. But for some inherent intelligence aspect of our system that I don't think science can purely put a handle on, we utilize these materials from Mother Nature to function properly. And I think it's also important to mention that potentially with these two particular polysaccharides, and it's not just from our research at the University of Miami, this is actually from many scientists around the world who have been looking at these two particular plants. I would look to, again, don't, just take my word for it, look to PubMed and do your own homework, but I would look into the literature. And then, in my opinion, compared to curcumin, which comes from the turmeric root, I really can't think of any other two plants, again, being aloe vera and rice, that Mother Nature provides for us that has such incredible health promoting benefits to them. I mean, it's just, and again, this is not my opinion. This is based on the published scientific literature. Time and time again, you see all these different studies that document different mechanisms of action of these two polysaccharides. And so I'm putting this whole picture together. Basically, all of this data that have been published are very compelling. And again, I would put them up against pretty much anything else known to humanity other than maybe turmeric as being our most beneficial tools in our toolbox, if you will, of something that we can take every single day to promote our health. And oh, by the way, you don't have to wait till you get sick. I mean, prevention is just as important, if not more important, than treatment or therapy. So gosh, why in the world would you want to wait till you end up with a diagnosis of cancer or diabetes or heart disease or neurodegeneration? Let's try to prevent those things from happening in the first place. And in my opinion, I believe you can do that with these two polysaccharides and take them every day. I've been on it for 10 years. I've had my mother on it for 13. My wife started taking it 5 years ago when she was pregnant with our daughter. When Angie turned 6 months of age, we started her on them. So literally from, fetus to newborn to elderly to all of us in between, we all need good and proper nutrition. And we know through many different studies that these polysaccharides are used by every one of our 30 plus trillion cells in our body. So they're incredible. I mean, they're just incredible. They're just very special compounds that Mother Nature provides for us. And I would encourage everybody to consider using them.
I love that. I love so many aspects of what you said. As you're explaining, I could hear and feel that you are open-minded. I am looking for what works. And
That's
guess
right.
what? I found something. And it doesn't mean it's the only thing, but dang, this is good. And I really appreciate that, because then it helps me feel like, oh, he's not just pushing this because this is what he's, studying. This is his product. It's because if you look at the research, this works. And that makes a difference.
Well, and if I can, I mean, to your exact point, 20 years ago when I met Dr. Reg McDaniel, who introduced me to the aloe vera story, and Barbara Kimley, who introduced me to her story on rice bran. Barbara in Fort Lauderdale, Dr. Reg in Dallas. I mean, these two people didn't know each other, but they both came into my life around the same time, about 20 years ago, and were sharing with me their stories. Linda, at that point, the only thing I thought about polysaccharides or saccharides in general was that they are sources of fuel for the cells. And that was it. I had no clue, literally. And this is not the fault of my professors or anybody else that I had known up until that point in my life. I had just not met two people like Dr. Reg and Barbara who had had such profound experiences in their own lives, and then were so interested in sharing what they had learned and what they knew with me. And then, as you said, I'm still an open book. I mean, I'm still open to learning. I don't feel like learning ever stops until we die, but it didn't just change my career. It completely changed my life, learning from these two people who I'm so grateful to have met. And now this is where I am today, almost 20 years later, and why I'm having this conversation here with you about all of this research we conducted with Dr. Reg on the aloe vera side, with Barbara on the rice bran side. And now here I am today, kind of, if you look at it like a relay race, I have taken the baton from them, and now I'm running in my leg of the race, and hopefully passing the baton on to many other people as we go through this journey together. But again, these polysaccharides were nothing I knew anything about 20 years ago. And now here I am today on this, polysaccharide bandwagon, if you will, trying to share this message of something that's so simple. I mean, you don't even have to know biochemistry or physiology or anything else, but just if you have any capacity to read a little bit of technical information, and we try to put as much information as we can on our website that's, readable for most people. I mean, you can only knock scientific language down so far. It still has to be science. It can't just be, like something a fifth grader or, lower is going to read. It still has to be a little technical, but nonetheless, all you have to do is take these things. It's not like, performing surgery or traveling to the stars or, anything complicated or technical. It's just simply being able to recognize, wow, there's something special about these two plants. Let me benefit from them. And that's really it. I mean, there's no limitation to anyone who can utilize them and benefit from them. As long as you're functional and you can open your mouth and swallow, you have the opportunity to benefit from them. So it's really as simple as that.
Well, that makes it pretty accessible. I can open my mouth, I can swallow, I can do that. Isn't that
Exactly.
wonderful that how our body responds when we give it what it needs? This is what I
Exactly.
need. Help me out here. And I love that analogy of passing the baton. I love when people who have learned something that works share it and pay it forward so that it can work for someone else. And that's really why I'm here, what I'm doing. Let's hear these good ideas, things that work, things that will benefit you. And let's pay it forward. Let's help people know and understand what's here. Oh, this has been so amazing. Is there anything that you want to make sure that we cover before we close today?
No, I would just say again to, for those folks listening, to make sure that you appreciate these polysaccharides from aloe vera and rice bran are unlike any other sugar, to my knowledge, out there. And don't be confused by anyone who's out there saying that all sugars are bad, because that's absolutely untrue. Just our little group alone, just our little research group alone has documented so many amazing effects besides all of the other science that's been published around the world. So please consider that, and then take the next step and utilize them. I mean, that's all. That's really all you have to do, is just consume them like you would any other part of your daily routine, and I'm sure you will benefit from them.
That is beautiful. Thank you so much for visiting with me today.
Thank you for having me.
In closing, I'd like to share a quote by Hippocrates. He said, "Let thy food be thy medicine, and medicine be thy food." Today, I invite our listeners to enjoy good health by eating good food. See you next time on Linda's Corner.
Thanks for listening. Please share and subscribe to help us reach new listeners. And if you'd like to heal your life from the inside out, there is a free video series at hopeforhealingfoundation.org. Just click on the free stuff tab. I also invite you to grab a copy of one of my books, like Crushed, A Journey Through Depression, and You Got This, an action plan to calm fear, anxiety, worry, and stress. See you next time on Linda's Corner.